While most patients will recover from COVID-19 without lingering side effects, others might find themselves developing issues in their lungs and other organs. The CDC saying that lung function abnormalities are possible. News 13's Faith Graham spoke with a local doctor to see how COVID impacts the respiratory system and what treatment may look like.
Panama City doctor Marwan Obid says he's seen a rise in patients presenting lung issues due to COVID-19.
With all the flu season we might have 1 or 2 or 3 for all the flu season. Here you see them on a routine basis.
As people recover from the virus, the doctor says side effects vary depending on severity.
The people who are severe, who stay on the ventilator in the hospital, those are the people they last longer, around 6 months to recover.
But still, some develop respiratory problems if the virus reaches their lungs.
The virus go inside the lung and stay in the alveolar area, and the body tries to react to wash it out. They secrete a lot of secretion from what we call the inflammatory process.
Dr. Obid says this makes it difficult for oxygen to go in.
If those liquids stay a longer time, that will precipitate down on the road what we call it pulmonary fibrosis, or the scar tissue.
The pulmonary fibrosis causes the lungs to become damaged and thick, and recovery can take a while.
Usually we'll monitor them by CAT scan to see the scar tissue in the lung. We'll monitor it every 6 weeks to see how the improvement in their lung.
As for patients who develop COVID pneumonia, Dr. Obid says they're typically given antibiotics, among other things.
They will get vitamin D, will get some zinc, and they will get some steroid and nebulizer machine and some inhaler with a steroid. It depends on the level, what kind they have.
For those with active COVID infections, the doctor recommends monitoring lung function periodically.
Usually now, a lot of patients now they order or they buy, those what we call it finger oximeter. You can measure your oxygen with the fingers. And as long as your oxygen above 90%, you'll do fine.
Experts at Johns Hopkins say recovery from COVID-induced lung damage can take anywhere from 3 months to a year or more. In Panama City, Faith Graham, News 13, Panhandle Strong.